Now, if you think about the fact that the exam is one that is a multiple choice exam, then you should realize that the point of this exam is for you to think about differentiating between like cohorts of things. So, for example, a well-constructed question in my field might ask about causes of pneumonia, and then on the list of options you would have to choose from, all of the agents would be there in alphabetical order and would be microbes that cause typical pneumonia. So your job is then to think about the patient, think about what you've been told about their symptoms and signs and history and physical results, and evaluate which one of those like things is actually the one that's causing the problem in your patient. So if you know that in advance, then you should always study things by going through like lists of things and making certain that you can distinguish between them. So not just memorizing a list, but thinking for yourself how it is actually that I would tell one of them from another. This is very unlike what you may have seen in many of your medical school exams and tests up until now, because often if you're asked to write an essay or a treatise about something that you've studied, then the point is to simply regurgitate everything you've learned without necessarily having an organizational plan for differentiating. So it's very important for you always to learn sets of things for a multiple choice question and to think about how to differentiate between them, how to decide between those multiple options, because truly that's what a physician does. Okay? Now, one of the problems that I find universally in my students, and there have been thousands of them over the years, is that when you're confronted initially with a good textbook or a good source of information, be it the lecture notes of a particular faculty member or whatever, you are so enamored of what you find on the page that you have a tendency to do what's on the right-hand side of this image rather than what I'm trying to encourage you to do as you study, which is on the left-hand side. So realize if I'm simply taking one of my dozens of highlighter pens that I know all of you have, if I'm simply taking those pens and making the entire page fluorescent pink or yellow or green or whatever, I'm not helping myself to differentiate and distinguish between sets of things. So I always encourage my students to try to make the amount of material that they are reviewing become smaller and smaller and smaller as practice with the subject makes it certain that they indeed understand that point. Okay? Now, when we think about a multiple choice question, realize that there's a big difference between whether I asked you in an essay to write down everything that you know about elephants. Okay, that would take you several pages, depending on how much zoology you know, but it would take quite some time. Versus if I asked you, how do I tell an elephant from a giraffe? Well, that thought process, of course, is asking you to distinguish between things. And so the fact that both of them have four legs and both of them have a head and a tail and both of them have a mouth and two eyes, those things would go away as I searched my mind for the things that make them truly different. So if I'm thinking about the exam in that way, realize that distinguishing between sets of similar things is exactly the way to approach a diagnosis, which of course is a clinical skill that they are wanting to test to see if you are capable of, okay? It becomes a smaller topic, but it still becomes a more focused topic that would help someone. For example, in this scenario, if you were out in a Jeep in the Serengeti Plains, you could look out the windscreen of that Jeep and say to yourself, well, that thing with the very long neck and the spots has got to be the giraffe. Even from a distance, I would know what to focus on after having that discussion with myself. Okay?